5 minutes go. So I have 5 minutes, 5 slides to say how we're going to transform healthcare. I can take my time. When you think about healthcare, let's start with who gets healthcare, the patient. The patient will spend a few hours with the doctor, a lot of that in the waiting room. Will spend a few days perhaps in a hospital. And where do they spend the rest of their years? At home. Well, doctors are now starting to get electronic health records. Hospitals have had them for a while, however clumsy they may be and so on. But there's no way to get good, real-time, comprehensive information out of the home. And if you can't get good information out of the home, how can you provide comprehensive care management? Because it's in the home where most of the significant events happen in a patient's life. So whether or not you're an elderly person who now is getting home care, or whether you are somebody who's just been discharged from a hospital, or for the first time you've, all of a sudden you need to have all these additional services or needs coming into your home, and yet there's no facility with which you can get good data in order to do that. And what you don't know can hurt you, okay? Because the lack of actionable data from the home means we have excess visits. Admissions are the first way of preventing readmissions in a hospital, certainly then readmissions. This exposes, everybody's familiar with Medicare penalties for hospitals for excessive readmissions. If you can't treat problems when they're small, they become big problems. And so you need to intervene early, and you need to intervene effectively to provide what I call the lowest cost available response, appropriate response. That is to figure out what needs to be done and do it sooner rather than later. You avoid transitions from home to institutional settings, which can be avoided if you get good information. And there's a lot of unnecessary suffering for patients and their families because of this inadequacy of care. So we fill the missing link in care management, which is in-home care data. We provide an electronic personal health record, which gives families, all healthcare providers, case managers, et cetera, the ability to track critical in-home conditions, establishing a baseline of what's normal, spotting trends as they emerge so you can respond to them, and being able to intervene so you can keep small problems in the home from becoming big problems in the hospital. And that avoids more expensive and more burdensome care as all the strains on the system, whether they're for families or for providers or for the cost of the system themselves. So we keep people at home and out of the hospital. How do we do that? We have this unique icon-based language which we've invented, which enables people, regardless of their computer skills, of their English literacy, to enter enormous amounts of data in real time. We collect information on personal care records, on mental health, which Alzheimer's and dementia organizations really like for us, whether people are taking their medications, whether they're eating properly, drinking, all the activities that you need to track in home. And in addition, we have these unique sliders, because when you go home from a hospital, when you're given health care, most people don't have telemonitoring devices. They don't have cuffs. They don't have elaborate systems which enable them to enter a glucose reading and then transmit it in real time to somebody who's going to take a look at it. So we have a very simple, nice system which enables people in the home. Here's how you can enter a blood sugar reading. Okay, it's extremely simple and very intuitive to use. And it's part of the entire system, which has all these icons so you can get information on mental health, eating, special problems, such as a fall or anything that happens which requires or triggers an alert. And we have an alert system which sends out to a case manager or provider based on a behavior such as refuse medications 3 times in a row, an event such as a fall, or a reading from a clinical sign such as your glucose spiked to 300. And we can do these so we can track the critical data points so that you can keep people, which way am I going here? We can get real-time behavior and clinical data integrated into one system in the home in order to provide the kind of benefits that I've been talking about, including support, education, and training for people in the home so that they can learn what to do and keep a response from escalating into a hospital or ER visit and lowering the cost. We have trials coming up with the geriatric faculty practice at Maimonides Hospital in Brooklyn, with Beth Israel Medical Center, where we'll be tracking post-discharge heart failure patients to reduce their readmission rates, with the University of Southern California School of Social Work, Keck School of Medicine, to manage patients in clinical community health centers for dealing with chronic conditions. And as Dr. Barbara Paris at Maimonides said, eCaring can save lives. Thank you.